Hello? Yeah. Okay. All right, guys. Good afternoon. Thank you so much for being here today. Our students left. They ran away. We have one student. Thank you for staying. um, well, it's gonna be very homey. We all know each other here. So I do appreciate everybody taking the time from the busy schedule and driving out here, in the afternoon. I know traffic is really bad. The purpose of this is we're, as Mental Health Task Force, the chair, and my task force members, William, who's here, say hello, and Maria right over here. We try to set this up just so that we can provide resources and educate the community on mental health resources for crisis intervention, and just want to share what all the good things that that Miami-Dade County is doing and that they have out there. I'm going to go ahead and introduce my team from Baptist. They're going to talk about the new urgent care clinic that they have here in town. Emergency room. It's not urgent care. Sorry. Emergency room here in the town. And then we'll take it from there. Then we're going to have Thriving Minds. We have Hosby over here. Thank you so much. The CIT Coalition team. And we have Luciana from West Care as well. You ready? All right.
No, I think
Yeah.
Blake's gonna do it. I'm gonna let Blake do this. Listen, if anyone comes to get a tour, Alex will say, I'm the guy to get the tour. So I love talking and selling this product line. So we're gonna introduce ourselves. My name is Michael Seeley. I'm the Regional Director for Emergency Medicine for Baptist Health Outpatient Services. So about 8 years ago, I was given the task to help bring this to fruition. So I spent 2 long years in a room with a big binder, looking at every statute, every rule, everything. And then I took all my experience from emergency medicine. I've been with Baptist Health now 29 years. So most of it's been in emergency medicine or acute care. So I took all my experience of when I was a patient. 11 years ago, had a heart procedure. Never thought it would happen to me. I was one of 5 boys that got my dad's heart. I'm the most healthiest. And so, but at the end of the day, I was that patient. I'm like, oh my God, I was so scared. Because I know what the outcome could be. And I'm laying in this bed in the emergency room. I'm like, just leave the door open. Are you going to come back and tell me? I know it takes 30 minutes to get my labs back. So then I said to myself, well, how can I make that experience for that person in a chaotic situation seem safe? So Blake and I sat down when we first met. He was our first manager at Country Oak location. And we came up with a philosophy that every patient deserves to be treated in a safe environment by knowledgeable staff providing quality care. And that's what we have done. This one off-campus ED grew to 2, to 3, to 4, 5, and there's 3 more after that. There's going to be 8, all the way from Boca Raton all the way down to Homestead. So what we've done is, and we opened up during COVID, we were seeing over 300 something patients a day. So we don't know where these people would have gone, because all the hospitals are overwhelmed and inundated. Now COVID's over, we still average about 200 a day in our 2 busiest locations. We just opened this beautiful site in Miami Lakes, which Blake will give you the pictures and everything else. This place is 22 beds, state of the art. Alex Sanchez can tell you, it is amazing. Automated CPR machine, ventilators, BiPAP units, high flow oxygen, CT, ultrasound, vascular, X-ray. We actually delivered 4 or 5 babies. Our youngest was 25 weeks and we saved the baby's life. So all of our nurses are trained, not only as hospital ED nurses, our nurses are trained to be OB nurses, to care for baby once it's delivered. There's things we didn't know. I remember the first one, the neonatologist says, look at the feet and tell me how many wrinkles, and I'll tell you the gestational age. I'm like, baby freedom, right? So the bottom line was, now we bring those people out and they teach us. We have all these protocols in place. We have an ambulance outside 24/7, 365, ready to transport you from here to your hospital bed. Now we are licensed at Doctors Hospital. If you do not want to go that far south, but Dr. Hospital is a wonderful facility. It's associated with orthopedics. We have every sports team in South Florida that goes there, but they do a lot more than just orthopedics. They have an amazing, they actually opened up new wings knowing that we were going to bring in things. And I took a tour of the new wing. It's beautiful. So if you don't want to go there, we'll send you wherever. You want to go to Memorial, you want to go to Palmetto. Don't know why, but if you do, we'll take you there.
Yep.
No charge. We'll put you in the ambulance and you can go. Then you can come back to us and say, oh, I didn't like that experience. So, and we'll do that for you guys. We also are, again, Miami Lakes or Pembroke Pines. We just broke ground in Pembroke Pines. So that'll be our 6th one that'll be up and running. We broke ground, that'll be open in anyone who lives in the middle of the north. But this place right now, we're averaging a little under 40 patients a day. I thought it'd be more than that, knowing that I actually was one of the first ones here, 1993, all the way by Barbara Goldman, before it was Barbara Goldman. Before it was the city of Miami Lakes, Dade County unincorporated. So I lived in an apartment over there where I was building my house in Pembroke Pines. So, but I love Miami Lakes. My kids went to school in Miami Lakes. My daughter's kindergarten teacher is still best friends with her, and she's a surgeon now. So it's just a small knit community that has given a lot to their people. And we're so glad that Blake's going to show you what this place looks like. If you want a tour, Monday through Friday, 8 to 4, this man will be there. If you want me to give the tour, I have no problem coming. So Blake, go ahead and take over.
Thank you. So, so my name is Blake Natino. I've been a registered nurse for 30 years. Been doing emergency nursing for about over 20 years now. Like what Mike said, we work really hard together. Our goal is really to give the best care to the community because everyone deserves. Nobody wants to be in the ER, but you want to be if you're gonna be in the ER, you have to at least feel at home that people are you're part of our family as a healthcare professionals, right? So with that said, this is our fourth off-campus ED. Like Mike said, we started this 2018 in Country Walk, and then the following site was in Coral Way. So last year, just to give you a rough number, so last year between two sites, we've seen 67,000 patients just for two sites. Last month, December last year, we opened Boca Raton, and March 6th, we opened the Miami Lakes site, which is around your neighborhood, right? So let's see. Oops. Did I press the wrong one? Oh, sorry. Okay, like Mike said, you know, it's a state-of-the-art facility there you go. There you go. All right, so we are licensed under Doctors Hospital in the state of Florida. We're called off-campus ED because we are off campus of the hospital, basically. In Midwest, you can sometimes hear it freestanding ED, standalone is the same, right? But for state of Florida, we have to be licensed under an umbrella of the hospital. So we're located at 15200 Northwest 77 Court. It's I'm not very good with direction, but if you're driving down south of Palmero, it's going to be on your right-hand side in 154 Street. Okay, there you go. Yeah, it's next to fire rescue across the fire rescue department, rescue 64, right across there. Okay, so it has a 22 beds ER, but of those 22, we have an ultrasound suite for our female patient. We want to make sure we provide them with a great experience and privacy. And we have one consultation room in the event that our 20 beds are full, and one triage room that is just an assessment area, basically. And triage is just it's a process. It's not a room. It's not a stage where you have to stop in a triage room. Maybe you can hear that in a hospital ER. You have to do triage in a room. A triage is just a process. You can do triage in every patient's room. So we don't stop in the triage until we're full inside, basically. So we've opened March 6, 2 months ago, and we've seen over 2,000 patients. And we've admitted directly to doctors about 150 admissions. In 2 months. So it's and the numbers obviously are growing. And with that said, Mike also mentioned that if your cardiologist is in Memorial, you just have to let us know. We have a transfer center that works throughout that networks around the area to make sure that you go to the right place where you wanted to. For us, we're not here to compete, but more so we want to collaborate and really partner with other healthcare, in the area to make sure that the seamless process, the seamless experience is given to the patient and family. We actually, for the month of April, we have actually transferred about 7 patients with a full-blown heart attack at Palmero. And a couple of them came back and thanked our staff because we normally get them out in less than 30 minutes. All right, that's our location. All right, so 22 beds, minor and major ailments, diagnostic imaging services, CT scan, ultrasound, X-ray, and I'm going to elaborate that later also. We have an on-site laboratory services. We are capable also of giving blood products. We have an ONEG blood, 2 units of ONEG blood in the event that you're coming in, if you're bleeding, if you have a ruptured ectopic pregnancy, if you have a GI bleed or whatnot, we're able to give that to make sure that, we're able to. Correct, yeah.
No, you have to come and see this place. I call it my boat.
Yeah.
You know that, oh, because the thing going, you know? So you have to see it. It's truly amazing. Two massive chemistry machines, hematology, coagulations, point of care, of course. So yeah, the machine now, if we're gonna test you coming having chest pain, usually take 45 minutes. That machine runs in a second. So again, we have invested the right machinery, the right people in the area to take care of people quickly. Our average, I don't know if he's gonna have it up here or not.
Yeah, we'll have
our
it.
average to stay is under 2 hours. Go to a hospital, see how long you're gonna wait. Over
2 hours. Yeah.
By the time you say hi to say goodbye, right now, seeing 38 patients a day. But even on our busier sites at 143 minutes, and they average 100 patients a day in a 24-hour period. So we're still under that 2.5 hour mark to where we say hello to you're putting your car or you're putting the ambulance going to your bed. So very, very quick.
We have also the pharmacy dispensing. It's like the same as the urgent care. Yeah.
Stop by the vending machine and get your medication.
Well, we have a little bit of over 40 formulary. So if you're coming out, if you're going to be discharged at 2 o'clock in the morning with UTI, non-complicated pneumonia, gastritis, let's say a simple cellulitis also, you're going home with your medication through that pharmacy dispensing. And also it's cost less than, regardless you're insured or not, it's the same price, which is another good thing for our, $8 average. Yeah. And also we receive patients via fire rescue. And Mike had mentioned we have a 24-hour ambulance. That's another thing that we invested in, that way we have a seamless process to immediately transport a patient in the event that we need a critical transport. All right, so Mike had mentioned average length of stay is 2 hours. That's always, yeah, that's the lobby, by the way. Yeah, that's the green one with the RX now, that's our dispensing. Okay, that's on the left side of our lobby. Okay, so sometimes people ask, so what's the difference between urgent? Because urgent is kind of emergency also, right? Urgent care versus emergency care. When you have this list of problem, never go to an urgent care, right? If you have severe pain, it could be abdominal pain, chest pain, never go to an urgent care. Difficulty of breathing, if you're shortness of breath, if your saturation is low 90s, below 90s, you need to be in the ER. Signs of heart attack, obviously, right? Severe bleeding, again, I mentioned about ruptured ectopic pregnancy, if you have a GI bleed or whatnot. The loss of consciousness, if you have a fainting spell, you need to be in the ER also. Severe burns, we have different dressings for that. Head and spinal injuries, sudden weakness or numbness could be a sign of stroke. And I think the stroke is one of our, we really work hard on this to make sure that we give the safest care to our stroke patients. If you call fire rescue, they're never going to bring you into a site because they have a protocol to follow. But if you walk in with any signs of stroke, we are even able to give you a thrombolytics if we have to. We have a clot busters that we give inside the CAT scan if need be. And we have a telemedicine that our neurologists will come out and collaborate with our ER team, seeing the patient while in CAT scan, and we'll decide right there and there if the patient needs a TNK, right, or a thrombolytics. And our goal is within 1 hour to give that. And from that, if you need more, if the neurologist will give further order to give any more imaging studies like perfusion, if you have a large vessel occlusion or you have a big stroke in your brain or part of your artery is really blocked, we do that as well. And then we basically collaborate with our transfer center and get you to Baptist Main to get you to an interventional to remove that clot.
Follow something like they have something called stroke ready. We don't even go by that. We meet the same standards. So if you walk into our off-campus or you go to a Baptist CD, immediately the doctor will see within 5 minutes. You're a CAT scan within 10 minutes. You have an interpretation within 15 minutes. The TNK he's talking about, the clot buster, has it usually on within 30. We average about 32 minutes. The ambulance is sitting outside waiting to put you on the stretcher to take you to Baptist Health. We did it. We timed it before we opened with 7 o'clock traffic and 4 o'clock traffic. Thank God for the express lane entry on 103.
Yes, true.
You couldn't get it. I mean, coming from north, you can't pick it up. But since then, dead traffic, 28 minutes with lights and sirens. So actually, Baptist Hospital is actually almost the same distance as Doctor's Hospital. Now you just stand on the Palmetto, a couple more exits and getting off. And the team will be in the ER waiting on you to take you. So we've done stroke patients already.
Yep.
So when he talks about we'll do a plain brain, the neurologist comes on screen through telemedicine, communicates with the radiologist who's on the phone, tell us right then and there. I'm not sure, let's do a perfusion study. We do the perfusion study. Everything is done right there in the suite. And then you just get on the ambulance and you go. So again, if you have those symptoms, please don't try to put one in the car because we just had a bad outcome at one of our locations.
Yeah.
So the son was taking the father someplace and had the episode. And he didn't make it. So, yeah.
Yeah.
So that's what 911 for, guys. Call
Yeah.
911, if you have those types of symptoms.
Right.
And put it over there.
Yep.
He's here, Narcan.
There you go. All right, so those are the cases, right, in comparison to urgent care. So this is our registration area. When you walk in, you're going to be greeted by our personnel over there and get you to we have a PINE-app registration that you just, if you've been to the Baptist before, you scan and. No, I don't think so.
So
Yeah,
guys,
yeah.
anyone who's gonna use our services, go to your app store and put Pine app in there. If you're gonna download it for Baptist Health, you can literally, in your car, as you're driving, register.
Register, yep.
You walk in, you scan the QR code, I'm here, your wristband prints out, I put it on, take it back to your room. So it helps us. I've been using it for urgent care forever. I go to urgent care, there's 20 people deep. I sit down, what are you doing? I'm gonna register. And they put the wristband, oh, I didn't know you could do that. We love it. Plus, when you go home, guess what's on your Pine app? All your medical records.
Yep.
I got my CT result before the doctor came back in the room. I'm like, Jose, dude, what's taking so long? I got my results right here. Why am I not discharged yet? So your lab, everything hits it right away. And if you ever want them, your discharge instructions will go there too. Your doctor's notes will go there too. So if you go see your primary care, you can
Yep.
show them everything. So please download the Pine app.
PINE-app, yeah, it will help facilitate. All right, this is a picture of our treatment room. Okay, and we,
Digital registration, guys.
Yep.
During COVID, we got rid of everyone that wasn't clinical.
Yep.
Registration is done totally virtual. You walk in, any staff member can quick register under 2 minutes. And then once the doctor sees you, we push a little button, person comes up on, and this is a business. We are gonna
national insurance.
ask you for your insurance. But if you don't have it, we're gonna treat you no matter what.
But after,
And if you're uninsured, we're gonna refer you to.
if I, there you go.
I just got the part-
Right. Okay. All right, so this is our trauma room, okay? Mike had mentioned, we have automated CPR machine. We have a state-of-the-art equipments that really can help out and save lives. This is our X-ray. And besides this X-ray that is at the site, we also have a portable X-ray in the event that the patient's in a lot of pain, then we're able to do an X-ray at the bedside. This is our CAT scan machine that can do your CAT scan for less than 10 seconds. CT brain. This is our ultrasound suite. We do vascular studies, upper, lower, and also yeah, blood clots. Yeah. No arterial. There you go. And this is our clinical lab on site.
Now, did you get the picture of the?
Of the massive one. No, I didn't. Yeah. But we've learned so much from the previous sites that we have a lot of redundancy. So when one machine goes down, we have an extra one. And to make sure that there's a continuity of care always. So I think this is the last slide. We're just grateful to be here to present to you. Next one will be thank you. There you go. So thank you guys for having us here. You have any question? We're here to.
Whatsoever. We are not a Baker Act receiving facility, but if you come into our facility, we will do a medical screening exam on that patient. And then if the patient is not medically cleared, then they get admitted to the hospital. If they are medically cleared, we work with a group, we found Ms. Banyan, who actually finds placements someplace throughout Dade County. And even in Broward County, because it's like in Broward County, gets you placed. So we do this, we have a total process in place for mental health if they walk into our facilities. And we want the patients to be safe and have the right care.
All right. Thank you, everyone.
Any questions though?
Are there any facets that don't even to be sending the artists, let's say, on the east corridor, around?
No, not as, no, we haven't gone that, Boca Raton's our furthest one, and it's off of 441 and Glades Road. Really, to your point, no, we tried to build one over on River. Maybe I should have, it didn't pass for whatever reason. But no, as of right now, no, because we have South Miami Hospital over there, we have other facilities over there. We try to build them at least 5 to 7 miles, the ones in Lower Dade County from the main hospital as well. But as you know, Miami Lakes and Dodgers Hospital is probably about 18, 19 miles difference. So that's probably the longest drive that we have right now. So, but no, to your point, nothing, of course, 995 as of yet. Any other questions?
Do you have people that walk in to be assessed for the paper?
Yes, every day.
You do.
So down south, we have a very, again, further down south, we have the homeless population. I actually came out one day, told a gentleman, the look homeless who was on a laptop, trying to charge his laptop, started having a whole conversation. He was in crisis. So I got him to come inside. We got him the help that he needed. So, I mean, that's what we're here for. That's what we're here for. And that's for us, it's a one-to-one. It's a high risk patient for us. Very high risk. We have to stop what we're doing and care for that patient and make sure they're safe. So we have a whole process for that. Yeah. No, you're welcome. You're welcome.
That's
Any
awesome.
other questions? No, we're good. Please come and get a tour. Yeah, please. Yeah.
Thank you so much, guys. I appreciate it. I like that connection right there. You see how we can spread the resources. Next up, Ms. Hopsy Kaba. Thank you so much for being here. She's going to talk to us about all the wonderful things they're doing with the CIT Coalition. I'll let
Thank you.
expand.
Thank you. Thank you so much. Good afternoon. Good evening. I'm Hopsy Kaba. I'm a licensed marriage and family therapist. I work for the 11th Judicial, pause, Criminal Mental Health Project, pause, CIT program. I oversee our crisis intervention team program for Miami-Dade County. Do you have, oh, she's working on it, I think. Yes, thank you, thank you, thank you. So how many of you, not my officers or my mental health people, how many of you are familiar, have heard of CIT? Okay, just a few of you, right? And that's why we're here. So crisis intervention team, let me tell you what that's about. Not only, I also want to mention that along with directing our CIT program for Miami-Dade County for the last 22 years, I've been in the field for 31 years. I also am the clinical director for our multi-agency first responder peer support team. Does anyone know what that is? Not my people. Yes, 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 right? So what is that? Yes, just someone to talk to, right? Just have that support. They're human, and we forget that. We often forget that they too, we dehumanize law enforcement. And so part of CIT's purpose and mission is also to ensure that law enforcement is well integrated into the community, because they do a wonderful job of it on their own, but we are part of that support and making sure that we're bringing people together, the whole community, to better understand the role of, most specifically, a CIT officer, or specifically now CIT deputies, right, with Miami-Dade sheriffs. Let me just highlight a few words here. CIT is a first responder model. Okay, it's police-based crisis intervention in the community, right? Also, I want to point out here that it's about the community, it's about behavioral health, it's about advocacy, partnerships. It's not just about, because CIT is very well known for its training, which I'm going to mention to you, but it's really about the partnerships, it's the collaboration. It's you and myself and law enforcement and mental health and people with what we refer to as lived experiences, right, of behavioral health coming together, and with the goal of improving our crisis response system, right? Because truly, crisis help, right, should not come in a police car, right? But when society can't manage something, law enforcement will be there to make sure that we are all safe and taken care of. But we never supported law enforcement to do that, right? the system has been broken, mental health system has been broken for so many years. And now, yes, we see many improvements, but initially when the government failed to really meet the needs of all of us, right? Law enforcement had to step in, and we didn't support them. We didn't give them the tools. We didn't give them the education. We didn't give them the resources. But we, and I speak in general as we, society, were very quick to point fingers at law enforcement and say, no, we can't do it, but you're not doing it right, right? Pointing fingers. And so I said I'm a licensed marriage and family therapist. And really, when I first started working with law enforcement, I thought my mission was just to advocate for people with mental illnesses. And I absolutely do that. But as soon as I started working with law enforcement, I realized that I too needed to advocate for law enforcement and bring people together. And that's what CIT is all about. We want to improve the crisis system. We work towards identifying the gaps and the barriers, and then troubleshooting, and then streamlining that system. And that takes a community, right? That takes every leadership of every community and every entity as well. CIT is all about safer responses to the community. We want to ensure, of course, the experts, our law enforcement, when it comes to safety, and we want to support them in that. We also, the word here, least intrusive, that when a community member has a crisis, wouldn't it be ideal if we could send the appropriate response? What if it's a homeless, elderly person who is not displaying, any threat, any risk? There's even let's say a medical condition there, possibly an emergency. He may be out of touch from reality. He can really, even lift his arm, right, to strike anyone if that's what, he intended to do. We think about the importance of sending the most appropriate response there. And that may be the homeless outreach. That would definitely be fire rescue. That could be a nurse. That could be a clinician, right? But not always should law enforcement have to respond to every call, right? And so what an ideal world it would be if we could assess the risk, right? And to be able to send the appropriate response to you, to me, to our children, to our parents, right? Who do you want to respond? God forbid there's a medical emergency, like, symptoms of a heart attack. We want fire rescue there fast, right? Who do we want to respond if there's, danger or threat, or I don't feel safe? Law enforcement, right? It would be ideal if we could send the most appropriate response and the least intrusive response for any one of us, that could be in crisis. And that includes law enforcement too, right? They are human. CIT keeps people safer. Law enforcement has done an exceptional job, and you're going to see some numbers with diversions to treatment instead of to jail, because truly we've criminalized many people with mental illnesses, because at one point, law enforcement wasn't aware of choices, of resources, of alternatives. Again, they were out there doing it on their own. And thankfully, when CIT began, it brought the community together to be able to assist law enforcement and take it off of their shoulders, because, they've been the lone responders for way too many years now. Oops. So when you look at this here, ideally, it's so important to have community services and treatment and support, in the community. Now, we have many. You're going to have Maria Guajardo talking to you today about the wonderful resources that we have in this community. And when officers come to class, our 40-hour class for law enforcement, something that is so consistent on the feedback is that they say, I didn't realize how many resources we had. Yeah, because we weren't telling you about all these resources. We weren't connecting you to, all of these resources. And when we provided and shared and connected them to all these resources, it gave them now alternatives. It wasn't anymore just an arrest or a Baker Act. Right now, officers not only had alternatives, but they had education and knowledge and a better understanding of crisis and how to respond to it in the most safest way. But here's the thing, the community doesn't know about all the resources that we have here in Miami-Dade County. How many of you are familiar with 988? Okay, you see, so every hand should be going up right now, right? 988 is that national crisis line, 24/7 suicide hotline, national. It was a 10-digit number, and who can remember a 10-digit number, especially now with smartphones, and then in a crisis? So 2 years ago, the number changed to 988. Everyone should have that number available to them. We shouldn't wait till something gets so out of control that now we have to call police, and then they are placed in a situation, that perhaps could have been avoided had the community, right, and the leaders of a community provided the community with those resources. There should be advertising everywhere. It should be on billboards. Do we even have billboards anymore? Social media. It should be in government centers, by bus, what do we call them? Bus stands, depots, whatever we refer to them as. I may be dating myself. In bathroom stalls and parking lots. And I've seen more and more numbers like 988, right? 988 is the emergency number, the 911 of mental health. Right? And if people became more aware of it earlier on, perhaps it wouldn't become an emergency where they have to call 911. So what is Miami Lakes doing, right, to educate this beautiful community, which I felt when I drove into to Miami Lakes, I took deep breaths, it de-escalated me to be here. It's just everything is calmer, it's just friendly, it's a beautiful environment. How are you, protecting your community even more so by educating them and providing them these resources so it doesn't become an emergency? And we want to ensure that people are aware of our crisis stabilization hospitals, facilities. As well, we have mobile response team here tonight as well. Luciana will be speaking. And we're very fortunate that in Florida, we have mobile response teams, throughout the state. So does your community know about mobile response team? And then thankfully, we now have CIT trained officers for the last 24 years. We have over 9,500 officers from MDSO and all law enforcement municipalities that have gone through the 40-hour training of CIT, which prepares them to better understand what mental health looks like, how to identify the signs and symptoms, how to de-escalate, how to really do a more thorough assessment and have alternatives, right? To divert to treatment when appropriate, right? When appropriate. And then you see here now that we have co-responder models, which we have our beautiful crisis response unit here today, which they're going to speak as well. So we are so fortunate to have so many resources in our community that one of our sergeants was telling me that we had Oregon visitors, law enforcement, and they were so impressed by what Miami-Dade Sheriff's Office is doing. We are doing so much, and they really deserve that recognition. Here in Miami-Dade County, we have a CIT program. We have over 3,500 CIT programs in the United States, and then we have more in other countries. Just 2 years ago, I was very involved in the implementation of CIT in Spain. So Spain now has CIT. We have 2 training sites. One is under the 11th Judicial Circuit, and we also have a Miami-Dade Sheriff's Office, who now has a CIT training school, and Detective Terral is here today, as well as the CIT department coordinator. So he's, you're going to meet everyone in a moment. I'm going to speed it up here because I want them to, have enough time here. So we have partnerships with all 36 law enforcement agencies, with the behavioral health, all of our providers, with all of our stakeholders like NAMI and so many other wonderful associations and organizations. And as I mentioned, we offer a 40-hour training that's designed specifically for law enforcement. The only other professionals that may attend a 40-hour training are instructors. And of course, for example, our mobile response team. We want clinicians and those that are out there working with law enforcement, with CIT officers, to come through the CIT training as well. We also go over legal aspects. We spend 8 to 10 hours on de-escalation. And we also, very importantly, have a first responder wellness segment, right? Because how can we ask deputies to take care of others' mental health, right, if we're not helping them and showing them how to better take care of their own mental health? It starts with them. How are we taking care of our deputies? That's a question that, I want you to think about. And also now we have Miami-Dade, I put Miami, but it's Miami-Dade Fire Rescue, who is now coming to CIT. And when the county does something, really, truly the rest follow. Right? When Miami-Dade Sheriff's Office does something, then the other police municipalities, eventually follow. Right? And so I want to make sure that you are familiar, and you'll have my information at the end, that we have CIT coordinators in every police department. So here in your district, you have coordinators. You have Deputy Amador, who is here today. Where are you? There you are. Yes, a very critical, important role because he is the face of Miami Lakes District, and he represents CIT. And he is there to really lead the CIT initiatives and to ensure that anyone in your community that needs anything, any resources, wants to learn more about CIT, better understand how to also support and partner, you have your own CIT coordinator in Miami Lakes. And we also we have a CIT collaboration meeting. How can you get involved? We have a CIT collaboration meeting where we average 100 people in our meeting. So we have all of law enforcement, all the coordinators, we have all of the providers, the hospitals. Baptist joins us as well. You don't have to have a Baker Act receiving facility. You are part of the community. You just said that you have people walking in that need assessment, right? So we're all on the same path. We just need to know who we are so we can walk together, right, towards the same goals and the same mission. So it's very important that you become familiar with the partnership so you can network. We do so much networking, and we know so many people because of this one meeting that we have quarterly, where, as I mentioned, like 100 people show up. These are just some of the trainings that are offered by CIT for officers. They not only need the 40 hours, but they need refreshers. We want to make sure that your deputies are well trained and have, the cutting edge information and initiatives and the best approaches and models, right? Very important to do that. And so here's where the numbers come, and then I'll be done, and I'm gonna pass it on to Jose and to Detective Terrell. Let me be formal. And the wonderful lieutenant of the Crisis Response Unit. Miami PD has a crisis response team, so it's similar to this, but different. But I always have to think, is it CRU or CIT? So, I mean, no, you see, there's too many acronyms here, but yes, they are CRU. So look at these numbers here for a moment. On average, CIT officers, deputies respond to 20,000 mental health crisis calls each year here in Miami-Dade County by Miami-Dade Sheriff's Office and the City of Miami. We're only talking about 2 agencies because they are our largest agencies. So we've asked them to track numbers. Data is very important for really since 2004. But here we have it starting 2010. So in 2024, a Miami-Dade Sheriff's Office and the City of Miami responded to over 11,000 crisis calls, which resulted in nearly 9,000 individuals being transported to crisis facilities in 1 year, right? Over 1,500 were diverted, right? And that means they could have been charged, right? Say with loitering, with a nonviolent, right, crime, but they were also meeting Baker Act criteria. And the statute states that law enforcement shall divert to treatment instead of to jail with nonviolent misdemeanors. It's really important for them to know that, right? So there were that many diversions. They could have been arrested, but the CIT deputy, trained deputy, right, realized, recognized, assessed through his or her training that this person needs psychiatric stabilization. There could be charges later, but most likely there won't be. But what they need right now is help. Right? There were, look at this, out of 11,215 crisis calls, there were only 119 arrests, right? I mean, that's just very, very impressive. Since 2010, these agencies have responded to a total of 169,564 calls, which led to almost 115,000 diversions, 67.7%, and only 635 arrests since 2010. Which is only 0.4%, which averages to less than 45 jail bookings annually. That's just, truly unheard of. And other states are so impressed. Law enforcement communities and mental health communities are so impressed, with these numbers. So due in part, I'm just going to read it in case you can't, right? Due in large part to CIT, the average daily census in the county jail system has dropped from 7,200 to 4,400 inmates. That's 39% of people with mental illnesses. And the county has we closed an entire jail at a cost savings of taxpayers of $12 million per year. Across law enforcement in the county, it is estimated that CIT results approximately 3,757 fewer jail bookings of people with serious mental illnesses, schizophrenia, bipolar, depression. And this last one here, with an average length of stay of nearly 30 days per booking at a cost of $265 per bed, right, per day. This reduction in jail admissions results in 109,704 fewer inmate jail days. That's 300 years. And an annual cost avoidance of $29 million per year. That's what, state officials, county officials, it ends with the, right? It ends with the dollar. And this is proof of all the great work that law enforcement, mental health, working together, the community to reduce the criminalization of people with mental illnesses. And so as I segue to our wonderful law enforcement team here, I just want you to know that now throughout the nation for many years now, actually. But we saw a big increase of co-responder models in the state of Florida. It really spiked after COVID. And we saw so many communities in Florida just start, initiating crisis response units, crisis response teams, co-responder models, alternative responses, non-law enforcement responses. So a community should have options and choices. I should be able to, I just need an assessment. I feel fine, but I just, I have a mental illness and I've been struggling. I haven't found the right doctor, and today I'm not feeling great, right? But I'm okay. I'm making decisions. My judgment isn't impaired. I know that I should get an assessment. And I hear about mobile response team. And they come and they assess me and they'll tell you all about what they do, but that's non-law enforcement, right? Or wait a minute, you're telling me that I could call police and they have a unit where these officers have, all the training that is out there. They are superior in their knowledge of mental health. They are specialized in responding to someone like me in crisis. Now I feel a lot better about dialing 911. Right? And they'll explain everything about what they do. But what we're doing now in our community is providing choices for our community, keeping our deputies safer, keeping our community safer, our people in crisis safer, because that's what we want in the end, right? That's the same goal. We all have the same goal. We want to be safe and we want to be well taken care of. So I couldn't be more proud of our community, because today, of course, we have Miami-Dade Sheriff's Office, and you will be very impressed by them. But, we also have other departments that are moving towards new initiatives with mental health, and we're going to see this growing much more in the coming years. So I want to thank you for giving me your attention, for giving me your time. And this is the QR code that can take you to our website, but you also have my contact information there. But I would like to invite the lieutenant to come on up. Yes, thank you. There you go. Okay.
I don't want to blow your ears out. And I was providing specialized training in mental health. The concept of ERU is maybe enhance that case. That's one of them. And the co-responder model that she was explaining entails law enforcement working alongside women to more effectively assess situations and ultimately service. My name is our CATV coordinator. My name is Jose Corral. I'm a detective coordinator here with my Sheriff's Office. There was a department a long time now. I also was CID a long time ago as well with way back when. As about a year ago or so, I was elected to the department CID coordinator. And what that basically means is that I am coordinating the CID class that we are putting our officers to do. It's the model that our department uses to try to basically put every officer through CID, because that means that, we have a specialized unit that's more dedicated to the health field, but having that training on with all our officers is obviously going to be a benefit, because we may not be always the officers that are around when the emergency happens. So we have that training, but also what I do in my role is, I attend CID collaboration meetings for a lot of our teaching facilities as well as, emergency hospitals. In order to have that relationship in the event that there's some kind of, issue that we need to work out. I can give you a lot of different examples, but, we have time like that for that. But when we have that point of contact, if we have something that are more often, like, if you're going on the hospital, I can be in contact with you right there, we can work on it right away. And that works the other way around as well. Also, as a kind of interaction, if there's something related to the interaction that happens with our officers, great, with the whole call meeting, and we start working on it. And then we try to stay on top of the training, and develop different things that are going on it. And we get the CIT conference this year as well. And, yeah, that's about it. I don't know.
How you guys doing? Sergeant Orto with West County. Actually, I was given the time of my late to start here. That's why I left there with, that we had still out there to work with it. Pretty much when we started this program, we're right from the get-go. We've been here since the inception of this program. It's been about 2 years now. And the difference that we make on the road is huge, compared to the stigma that there is when you see a brown shirt, right, or whether uniform officer and mental health, you usually get that role where they come out, they got somebody, they break the hospital, and it's an ended cycle, and you're taking this person in, and they're not getting help, and we're bringing that in a solution, it's in a run. So what this program does differently is we come out and we dedicate as much time as needed to get to the situation, make sure the crisis is down. First off, we already saw the uniform system, right? So we're trying to go away from everything so you do with other friends groups going on. So it is. So we give different colors, we don't respond to calls in mark, green, white. We don't have marked card, we're in the other card, right? We also respond with a clinician, with a civilian or firefighter, we borrow a couple of firefighters, can be a part, and they work with us. They have the doctors, they have extensive background in medication, in all kinds of mental health diagnosis, all that. And so what they do is we come out, we make the scene safe first, right? We de-escalate everybody, and then our clinicians come in, speak with the family members, speak with the person of concern, make sure that they're okay, and their needs are met. And once we de-escalate everything, and we bring in all resources, and drop it off, in fact, we maybe 2-3 hours more. We take this person, we take them to the hospital, I think we're right, and they're supposed to do a big grab. And once at the hospital, I just drop off and go. We follow. We follow up with people, make sure that they are doing the patients, that they have their next appointment set up, we talk to their patient managers. We have extensive background, and we follow up with people several times during something else. And we've noticed that with that, the drop in call, because we're taking people's houses, right? So no longer a family member is calling in, this person wants to have an episode or there's something going on right now in the crisis, it's lowering the numbers because right? So if you were to compare it, we're not just going out there and take back from everybody. We're not. If you look at the numbers, we'll see everything because we're making about 40%, which means less than half. We're coming out there and we're correcting the 70%. And they don't need to go there. We give them the right help, give them the guidance, the resources. Versus if you look at countrywide, they're doing about 80%. They're getting there. Not giving any time to it, smashing people up. So we're really trying to kill that stigma. And I think in the 2 years that we've been doing it seems like we've done an amazing job. And another tidbit, just so you guys know, in 2 years that we've been around, we've only had 2 youth forces. Meaning that we have not had to hurt anybody, we have not had to forcibly take somebody's life, nothing like that in 2 years. We have 2 youth forces. One is some guys who really, really they think it's that. But to add to that, we do monthly training, so we're constantly training, which is something hot about it. We're constantly getting top training. So we're going monthly training where we're either speaking with resources like I would have here, or we're doing scenarios that you want to stay on top of what you're doing, right? If you don't practice something, So we do scenarios, we do, defensive tactics also to make sure that we pay people to cut in and take it as possible without hurting them ourselves. We do training just by everything, but we do sometimes have people are barricaded and we're about to change the wall back. We as far as, having to keep them on now, when people are barricaded inside, but we come out, we able to. We had not, well, not losing ourselves, but we're dying apart. We, something like to do. It's part of, 2-3 hours in the book of the month. But we got another cover up in this area. It's really nice. You know, I would love to say it's me, but it's not. It's my guys, and they're testing for hard work. They're awesome. They go out there, you know, we run it like family. Everything. They bring to me like Leon and like we right, you know. This has been definitely something amazing. But see the through I've been out 18 years now, you know, so we're CIP starting, right? We're at now, and what this definitely something that's going also out. I mentioned this one. We started off with only 3 pilots this year. Starting north side, we started in Hammonds and south this year. And now we've expanded. We have south, intercoastal, north side, Midwest, Kendall, Hammonds, and I think eventually we start branching out into the town like here, and we're slowly progressing. We're just going more numbers. And it's definitely anything else?
I'm not giving the touch on everything. We're just comprised right now primarily of 24 to 30 officers, specifically in the north and the south. Uniform, the vehicle, and one of the main things is when we arrive at the scene, we do this. Sometimes they don't meet our criteria, which is fine. Not everybody can be different. That's where we step in and say, hey, why don't we reach out to MRT, the mobile response? They'll come out, they'll do this today or tomorrow, whatever it is. So it's just trying to bridge the gap, right? But they don't meet our criteria, let's call out MRT, so they have more time. Right? There was a call earlier this week, I think on Tuesday, where mobile response was on scene. The individual, for whatever reason, didn't want to go with it. So they reached out to us, we responded, we took them to custody, we did take them to the facility. Another thing that's different with us is, I think we have an individual that does meet criteria, that does meet the same process. So people look at it and say, hey, where's he most comfortable at? Or where's the patient most comfortable at? So a lot of districts will say, hey, we got a patient for the year. Sometimes that facility doesn't work well with that patient. So I can say, where do you want? Thorough, citrus, DMA, try to make the incident as streamlined as possible. You take you where you're most comfortable at. That's something different that you from a Zoom that will do.
On that also, you also have a report with the so they know, they're familiar with it. So you'll have people call 911 and they all appreciate it. Awesome, you have that response.
Because a lot of times what helps is they know they're not gonna go to jail, correct? Right? A lot of times they don't wanna call, they want to go to jail. The other one gave blue shirts. Yeah, relax.
They actually de-escalate based off that.
Yeah,
They'll see us, oh, we're already over it, and they'll come down. So it's definitely, it's working, I can tell you. It's really, hospital is phenomenal. Phenomenal. The access.
Yeah, they want to talk to the head people, we know that.
No, some people would like that, and you have an office line where you can call there, if you have something that's not of an immediate emergency, right, like a routine call, maybe like, hey, I want to have maybe a family member or something checked out like that, you could call the office number, right, and they could take down the information, we could respond, but if you call just regular 911, they're not emergency line, right, they're by police. If you call that number, you request the crisis response unit specifically, dispatchers will reach out to us, and we'll have, the thing is also, we're not 24/7, we're not like the world. So, we're 10, 8, and 6P, which we have based on statistics, that is the busiest time. You know, it's kind of hard to say because people go at crisis at different times, but in the logistics, like in everything, looking at everything, realistically, 10 and 6 is that time. We hit part of the middle of the day and the evening too. So if you have something going on in 10 and 6, by all means, all the non-emergency or the emergency only one, and what's the effect?
So, translate, I'm sure you have to, how many beta articles were done about when we call?
So after 6, so we do have to run details, certain days we'll run details, we'll work double, then we'll work till like 8 PM, maybe 10 PM, and we see the number hasn't been significantly there.
It really fluctuates, right? So there was, our schedule was varied, meaning that you can move around depending on the need of the community, right? However, there was an analysis done. And the most prevalent times for mental health are they called, and it's 6. And for some reason, Wednesday.
Let's see.
Wednesday.
Get a little weak, I guess.
And for. We have a unit email address, and provide that for you, I can provide you 5 email addresses after, which is directly any concerns. One thing that we didn't bring up is there's a huge homeless population in the county, a lot of people, those individuals suffer from mental health illnesses, and so we also are big on homeless. And also a veteran. So the road may be overall, any encounter veteran. They're kind of restricted to the years, whereas we.
Yeah, the homeless issue to me is really late at night. And I know I'm about security at hospital. And we deal with homeless every night. That obviously they're having problems. Twice as many as they are apartments being stopped. And you know, the roads are on leaving everywhere. Hopefully, we don't know how to handle people so well. Maybe more where we're trying to keep it contained because you have patients that are there, you see, for whatever injuries, trauma, whatever they have, and then you have crazy person walking around. Police officers, security guards, 3 doctors, couple family nurses, just contain one guy. The other night, he's so out of his mind. That's the other problem with them that I've discovered over the years. Whether it's a mental issue or whether it's a drug issue, so many of them, it's a big effort to contain them because they don't feel the pain. They're, you know, it takes a lot to bring them down, get them under control. And obviously, if we had a group like you overnight, that would be a big help. That's a problem that's happening now and obviously going to continue to happen for a long time. And so we have somebody that's covering nighttime and overnight.
So just the fact that, the goal is for CRU to eventually be every district and every shift. I mean, that's obviously, I'd say, it's a lot of the works, but it's definitely the goal for us to do. And we do, we work on the details, we work on the homeless front. So we are able to get better and helping out. We have some of that, one of the board, is small. We try to do it, finance money. It's fine. Any more questions?
It seems like the numbers speak for themselves, and overwhelmingly successful, and with such a small element. So is the issue resources? Is that why the program has expanded into more departments, small offices, and keep up the departments that are useful?
Well, what I find the trend is not only here, but throughout Florida and other cities is that they're understaffed departments. It's not enough officers, not enough manpower. to do this, and a lot of clinicians, they just get paid very poorly, and they go for, other jobs as well, so, part of the issue. But what I've also seen is that everyone starts out with a pilot, and as you said, obviously, this.
It'll grow, we just had a transition over to share, so things are, you have to get used to it, right? We have had share for 60-some years, so that's a problem too, we're right now, it's like big rate of this, right? We're even, and having fast enough. Once we get back into it, I see it growing back, I really do, but we just have to, educated this afternoon, mental health is really, really, really popular. Nationwide.
Does help if the community, really shows.
Yeah.
We need this. We need
Yeah,
this
absolutely.
laws, right? The more they hear about it, the more, hey, why don't we get more of these?
We need to educate politicians. I thought we were gonna have commissioners here. Wonderful. We have a commissioner. I want to thank you. Where's our commissioner? I saw. They just, okay. They're the ones that need to hear it, and, that's where so many times we get stuck, that, the decision makers are, don't have all the information. But I know that, Sheriff Rosie, that's one of her pillars of mental health, so it's a priority for her, so I think we're very, and I work for her, and I'm gonna tell you, I feel very fortunate that we have her.
Well, thank you, absolutely. Yeah, thank you.
Thank you so much for that. That was super informative. And just to touch base on that, we did invite the town council to come to this event today, and we did share that with everybody. But unfortunately, I guess May is kind of a conflicting month and there's a lot going on. So we did try to get them out here because it's so important for them to hear this. Up next, Maria from Thriving Minds. Thank you so much, and I'll let you introduce your program.
Thank you. Thank you very much. Thank you for having me here to represent Thriving Mind. See if she has, I don't know, she's gonna put it up. So, there we go. I'm Thriving, Maria Gohard. I'm the Vice President Behavioral Health at Thriving Mind South Florida. We are the managing entity for Miami-Dade and Monroe counties. We have been tasked with making sure they're safe. We are the safety net agency for mental health and substance use treatment. What that means is the Department of Children and Families gives us funding, and we in turn contract with right now with about 48 providers of mental health and substance use treatment. We partner with the CRU, and one of their clinicians that follows up works with them. We fund the mobile response team, who will speak next in Miami-Dade County. So we are a funder of services for anybody who is uninsured or underinsured. So if an individual has no insurance, you're able to link them through either Thriving Mind to our providers or underinsured. So if a person does have insurance, but for example, substance use treatment is usually not covered by insurance, you can connect to one of our providers that, they may have insurance, but they're underinsured because they don't have coverage. See if it'll click. There's 7 managing entities throughout our state, and that's important because sometimes you'll see individuals, patients, whoever that are moving throughout the state. You can connect them to a sister agency of ours, and they're tasked with the same exact thing. They have funding for mental health and substance use treatment. We contract with community mental health centers like Banyan, their CSU, Citrus Health Network, CHI Down South, Jackson Community Mental Health Center. All those community mental health centers receive funding through Thriving Mind. We don't provide direct service, but we do provide care coordination in the sense that when you reach out to us, we connect you to the program, the facility, whatever is most appropriate for that individual. We serve everybody in the community, youth, children, adolescents, adults, anybody in the community that is in need of services. We have prevention services who are, those are mainly done in school settings and coalitions. And it's targeted towards raising awareness and fostering collaboration and making sure that, there's the view on using substances and supporting mental health is prevalent for our students, mainly for students. A lot of our prevention work is geared towards students, and we work closely with Miami-Dade County Public Schools to prevent use of substances and mental health. We fund crisis services. We work closely with crisis stabilization units, with the mobile response team and 988 through 988 is administered for our county through Jewish Community Services. And so we fund those services and collaborate with those agencies and try and spread the word as much as we can. So I was kind of taken back when you said, I don't know 988. I said, oh my gosh, we need to really do a better job of spreading the word. It's such an invaluable resource. I know Hopsy went into that. But it's really very, very helpful. We also partner with child welfare agencies. So any family who's had a DCF call, we connect that parent to treatment. So when the call comes in and a parent's using substance and that child is in danger, we are the bridge between the family and treatment and making sure that family receives treatment and those children are safe because of it. And treatment is usually for the parent and for the children, not just for the children. We fund outpatient services throughout our network of providers, anything from case management, therapy, group therapy, family therapy, medication. We do medication-assisted treatment. We do work with Miami-Dade Fire Rescue. So when they go on a call where there's been an overdose, they work with hospitals. They have a hospital bridge program and continue to follow the person for up to 90 days to make sure that they're receiving appropriate treatment. We do fund residential services, like I had mentioned, for both mental health and substance use. And we have different types of programs. We have programs for pregnant mothers or mothers with small children, a Mommy and Me program for substance use, so the mom can still parent and learn how to parent while she's getting treatment for herself. We fund different types of support services. We have a living room model at New Horizons Community Mental Health Center. The living room model is a person who feels like they're gonna undergo some type of crisis. Instead of going to a crisis unit, they can go into the living room. They can sit there up to 23 hours, be de-escalated, feel supported, be connected to resources. So we opened that up about a year ago. And it's diversion from crisis admissions. We also connect to life coaches, mentors, and peers. We have a large network of peers, of individuals with lived experience. A lot of our programs have a peer embedded in them. The living room model has a peer. Most of our programs have peers. We went from having a handful of peers to 84 right now that are embedded in different programs in the hospital. So when somebody comes, for example, with Miami-Dade Fire Rescue, a peer will follow that individual and support them through their process of recovery. I love that we have that. It's one of the biggest assets that we have. It's that person who's been through what you've been through and will help support you. It's not therapeutic, it's supportive. And we all need support. And, you know, our communities are so important because communities are that support. And within our system, peers are what create that support. We have recovery community organizations for individuals with substance use that need that support. So much like the living room model is geared towards mental health recovery, community organizations are a place you can go for the day and receive support and other assistance. Drop-in centers is another place where an individual can go and receive support. And it's, you know, I recently heard a presentation of one of our drop-in centers for New Hope Corps down in South Dane. And they said, you know, something as simple as an individual coming to charge their phone, right? Just get them in through the door to charge their phone instead of staying out in the street. And then you start to engage them. So all of these places that we have in the community are really building that support and preventing individuals from going into a crisis stabilization unit. Because like the officers mentioned, you take them into the crisis stabilization unit, and then what happens, they come out and then you take them again. When they go to these places, they find the support that they really need and just keeps them stable. 211 is another resource, as in NAMI, the National Alliance for Mental Illness, and they have so many support groups, and they have parent education, and they have parent peers, and they have wonderful things that they do within our community. NAMI also has, which is wonderful, at FIU and at other colleges, they have young adults, right, that have chapters of NAMI. This is my contact information and our website. Our website has all of this information. Please utilize our website. It's very up to date. It has all the services, all the agencies, anything that I spoke about and things that I may have missed on the website. You can always reach out to us. We have a link where you can leave a message and we respond the next business day. There's numbers. We also have a hotline or a warm line that you can call and leave a message, and a peer will call you back. So I encourage you to use our website and utilize those resources. So now I guess let me see any questions before I'm going to turn it over to our mobile response team. Yes, Hopsy.
Call them and say, hey, you know, officer needs guidance with the marchman, but they're on it. We have real-time situations, they're on it. So they are my go-to for substance abuse, for mental health, resources. There's no charge. They're lovely, lovely, lovely people working there. And I've been working with you, you know, since your inception. So
Yeah.
I really, really, really recommend that. You need anything when it comes to children, adults, you know, it's the leading agency. So thank you so much.
Thank you, Hopsy. So I'd like to introduce you to our wonderful mobile response team who's available in our community 24 hours a day, 7 days a week, and they do a magnificent job. Luciana, thank you.
Well, hi everyone. I'm Luciana Beltran, and I am the program director of the mobile response team. And we have a new program manager, which is Catherine Ortega. She's not here. She just joined us recently. Is anyone familiar, besides Hapsi's family, anyone familiar with MRT? Have you ever heard about it? No, nothing. Okay. So, okay. No, yes. Okay, so the mobile response team, we're a group of clinicians, 11, 13, counting me, licensed clinicians, mental health counselors, social workers, different social services, clinicians with a license going out to the community to do an assessment when someone is experiencing any sort of mental health crisis, substance abuse, or both. We operate 24/7, right? And we cover Miami-Dade County, the entire county. There's MRTs in different parts of Florida and every part of the country, actually, but we serve Miami-Dade, and we don't have a limit when it comes to age. So we can, actually, we go we are required to go to the schools. Miami-Dade Public Schools is required to call MRT for an assessment. Even if they have a student who has the criteria and they have enough to do a Baker Act or not, they call MRT for us to do the assessment, which keep us a little bit busy during the school year. But yeah, we do have a high volume of calls for minors. We serve all day, like I said, and we have right now 3 offices. We're supposed to have 4, but we have 3. One is in the north, actually close to Jackson North. One is in the central area, close to the airport, Blue Lagoon. And the south office is close to the zoo. And the reason for the locations is the response time, right? We don't drive. We have a BHT who's going to drive the clinician, depending on where the call is, where the crisis is happening. And it's a BHT in a regular vehicle, so we don't have like the fancy lights or anything like that. So we have to make it within 60 minutes, ideally. So far, we've been able to do it. Right now, it's not 45 minutes. It's a little bit higher, 51 minutes. But so far, we've been able to meet our the requirement of the 60 minutes. So this is a little bit of the staffing, right? How does it look like? Someone calling the line, I'm gonna give the number at the end. You're gonna have a dispatcher, which is a master's level clinician. So they're gonna do a screening. They're gonna ask the basics, right? The name of the person. And just so you guys know, only 7% of the calls that we have are self-refer, meaning that the calls are coming from employers, parents, neighbors, anyone can place a call. So, and this is a voluntary service, which makes it a little bit tricky because the person most of the time doesn't know where we're going or doesn't agree with the assessment, right? But we still have to try to assess. So the dispatcher is gonna do a screening. Actually, one of my dispatchers is here, Leslie. I have 6 dispatchers working 24/7. And they ask a lot of things, a little bit annoying sometimes, but they have to, right? Are there weapons in the home? Are there pets? How many? And things like that, because we don't know what we're gonna find. And we don't have any sort of like safety, if we wanna call it like that, other than our clinical skills. And I guess like trusting that everything is gonna be fine, right? And also the training that we have joined with HAPSI, the CIT training, all the clinicians have participated. But we don't respond with law enforcement. It's just a clinician and a BHT. Unless we find a need because we can hear the person, you know, over the phone yelling, destroying the home or whatever is going on. So we might have to go with law enforcement. And the BHTs are basically assisting. I want to say that they do definitely more than driving. They do driving, which is fantastic. I wish I had one for my personal life. But that's not only what they do, right? They also help calling the ambulance. They talk with the school if there's like a bunch of people talking, the referral source. They do a lot of things, and sometimes they connect with the client in a way that we don't, the clinician, right? So our behavioral health technician, you don't know? I know. I know. Okay, behavioral health technician. Feel free to ask. And the certified peer specialist. So this is what happened, right? The goal of MRT is not to Baker Act, just to like our dear friends from CRU were saying, the goal of MRT is to decrease the amount of hospitalizations in Miami-Dade. Why? Because there's less beds, right, in Miami. Every year, another facility closes, and also because nobody wants to be Baker Act, I think. I don't know, just my thinking. So with that said, the goal of MRT is to de-escalate. In an ideal world, you don't go to the hospital. I just want to give like a little bit of like numbers. I'm not a number person, but I'm gonna say it. We have an average of 310 calls a month, and our rate of Baker Act is 25%. So we assess if we are going to Baker Act. I'm gonna talk about transportation in a second, but either we Baker Act or not, we have the peers that are doing the follow-up after. And to me, the peers, I'm gonna say it, sorry, clinician Luis, but they do the best part. They do this. Luis is one of my clinicians, but they do such an amazing job. And I always tell them when it's happening in the moment, because you have like a parent that is upset, you Baker Acted my 12-year-old, he's not gonna kill anyone. Even he has like a PowerPoint of all the people he's gonna kill in the school, but you know, he's good. Why did you, no, you will be surprised. No, you will be surprised. And they're super upset, and then you have this peer, hey, my name is, Juan, I'm just calling to see, how are you feeling today? How's your son? And they're super upset, but then the peers keep calling, until the person is like, okay, maybe you guys are not that terrible. So, and not only that, right? They also have to, to link the family to provide resources, because we all know that in an ideal world, you're gonna discharge from the hospital with an appointment, and you're gonna go to your appointment, and you're gonna be fine, and you're not gonna be in crisis again. We know it's not that ideal, so the peers make sure to get the appointment, treatment, whatever is needed, and they follow up. And they can, technically, they're supposed to follow up 24 hours, 48 and 72, but they keep cases open up to a month sometimes, just to ensure that the person is connected to some sort of resource and that they go to their appointment, and if they need transportation or whatever they need. They do an amazing job, and Thriving Mind help. I mean, you guys have an amazing relationship right now with them. Well, they do have a relationship with you guys, which is really nice. They don't even talk to me about it. They just do it. And I'm like, yeah, so. How was it? Okay. So, well, Hapsi and Maria already touched this topic. So, and this is something that we also like to mention. Some of the peer specialists like to join the calls, which I think it's fantastic. So when the BHT is going out with the clinician and the peer joins, they as well connect in a way that we don't, right? Many times clinicians, we are full of like, I don't know, laws and regulations and things we can say, or we can move like this or that. So, but the peers can, right? They can be themselves fully. So, and also they have the lived experience. Either they've been in a Baker Act facility, or they have like, they are in recovery, or both. So they connect with them in a way that, again, we might not. I think, again, is the strongest part of the team. Sorry, clinician, again. I have to say the peers have changed everything. And this is just, I mean, a little bit of theory, right? Well, so just, so we don't assess only are you suicidal, homicidal, no, okay, peace out, bye. No, we have to see what's going on, right? A crisis can be a lot of things. A crisis can be someone who's just suddenly your behavior has changed, right? I mean, you were, I don't know, like doing exercise, you were going out with your friends, and there's a change in the behavior, the family notices, and they can place a call. And we're just gonna go have a conversation, see what's going on. Well, depression, anxiety, hallucinations, psychosis, you name it, right? What everyone can identify as a mental health crisis, but it's not only I want to die or I want to kill someone. It's way more than that. It's way more complex. That's the phone number, which is a long number, right? I wish we had a 98, but one, we don't. So 1-800-HELP-YOU. There's signs like everywhere, but they really don't represent MRT in my opinion, because there's a lady very sad and says life demands. Just saying. So, but that's the number. It's true though. Yeah, it says life demands and people call for, I don't know, food stamps. So that doesn't really apply to us. We do mental health assessments, and that's a phone number. Law enforcement has their own number, but I don't have it here. This is for the community. And what we need is, again, basic information. Even if you have someone that you know, or the friend of your friend, or anyone that might need help, we need, if you don't have the name, that's okay too, but any information and a location. Ideally, we know their name, the date of birth, psychiatric history, what's going on, the reason of the call, is the person aggressive, the pets, the weapons, right? And then we will advise that there's a 60-minute response in case the person is an emergency, or they already like try to hurt themselves, or they have like a weapon, or it's an emergency. We'll call police to go first, and then we'll also join them at the location. Oh yeah, we've been to Walgreens. Hi Maria, it's getting fun. Okay, so transportation. So in the past, I've been doing this for 8 years, and we didn't have transportation. I mean, we had, right? But it was law enforcement, which we love law enforcement, and Hapsi knows that I love to work with law enforcement. However, for a human being to go to a hospital, it's nicer to go in an ambulance, I think, right? We can agree. So we have MCT Express, and 80% of the Baker Acts that we do are transported via MCT Express. I don't know how. Luis, maybe you can tell me how, because to me, that's magic. Like, to have someone who is absolutely like, no, I'm fine, I'm not gonna go, I'm not gonna go, I'm not gonna go. I don't know what they do out there, but they end up putting the person in the ambulance. It's true, I have to say it, that's on them. And also we have, we can choose the facility where they want to go. So if we're in Homestead, they have the provider in Mount Sinai, we'll send you there. If it's a minor, they want to go to Nicholas, wherever they want to go, they can go to the provider or the facility of choice, which again, I think like our friends from CRU mentioned the same. I think it's essential and very important for for the person and especially for minors. Now, all our Baker Acts for children are transported via MCT Express. We had only 2 last month that we require law enforcement. Yeah, we call law enforcement if the person is aggressive or there's any risk that they can get aggressive and hurt someone or run away. This is just honestly a map. I didn't do this. This is just some zip codes that we serve, but we serve full county. And this is also from last year, but we are everywhere. I want to say that we get very busy in the south, like Homestead and Luis can testify for this. We had 19 calls on Tuesday in the area. So Homestead, Florida City, keep us very busy. And then the central area too, Miami Gardens is another spot for us. But it's kind of unpredictable. I want to say that Wednesday, someone mentioned that day Wednesday as a day that it tends to be busy. It's busy for us too. I don't know why it's all we've been busy. I don't know what's in the air on Wednesdays. Maybe we can plan something, but we also no, just saying. You said Wednesday. I look at them and Wednesday, right? Yes. So, anyways, I wonder what it is, right? It has to be something. Wait, hold on. No, let me put my information and then we go to the questions. Did you see I didn't do this? So that's my information, and that's information. Catherine is the new manager. That's my email, my phone number. Feel free to call mostly for feedback and for questions, right? I always say this in the trainings, like many times the experience is not perhaps what you expect to be. People want what they want. People call, you have to take my brother to the hospital. You have to do it, and right, and so on. So feedback, good or bad, questions, I don't know if this is appropriate or not. I don't know if you guys can help me with this. I think everyone knows here in this room that I'm available for the most part, all the time. And that's the law enforcement number, by the way. So now we can go back to anyone has any questions? I feel I talk like very fast. Okay, now we finish. Any questions? Anyone? No? Yes.
Somebody would make a decision, we're gonna call you or we're gonna call law enforcement, and they say, well, let me check, I'm not really sure it meets the severity of law enforcement, I'll call you first, and then you make that decision based on the interview, or where do you fit in with law enforcement? You operate by yourselves and then?
We do. So what tends to happen is like if we have someone who's aggressive or there's there's a history of the person can get violent, we're going to reach out to 911 and also we get calls from officers for a second opinion. They go, they assess, they don't have the criteria, and we go and assess. So that's how we work together. It's like a partnership that we have.
So, for example, have somebody that's
Oh,
talking to themselves.
we get a lot of those.
Or a family
Mhm.
member, and you have somebody that's acting off,
Mhm.
and they say, geez, I don't know if this is somebody that should be called, taken to the hospital, mental health, I don't know the resources.
Now you know.
Yeah.
But all that,
Yeah.
Yeah,
hey,
yeah.
I'm really worried about this person,
Yeah.
what should I do with them?
Yeah, that's what, yeah. Right, and it's 24/7, it's a free service, even the ambulance. And I say this because a lot of people are scared of calling. How much is this gonna be, right? Are you gonna send me the bill? No, so far nothing is being charged. No, it's not gonna be, it's a free service for the community. And like I said, like, it can be used by anyone. You will be surprised the calls that we get. Like every time we leave a presentation, like you have someone like reaching after, hey, I was in this presentation, I have this family member. We actually respond to a lot of it, employees from different places, and they place a call and we go to their home. A lot of people are working remote these days, and they said right since COVID, that's what happened, and it never changed. So we've seen a lot of those. We go everywhere, universities, the schools. I can't even mention. We go to church, believe it or not, parks. Mm-mm. So what happens with 988 is that if they transfer calls to us often, when they cannot de-escalate over the phone and they need an assessment in person. So because we go in person, they take the call over the phone. They try to de-escalate over the phone, but sometimes we need to, go out and respond and assess and Baker Act or not, but they need a human being present. And they will transfer. Yes, thank you.
they, sent their surrogates, so we have a couple of, Miami-based community care people that are here in their stead, so.
Thank you, very, yeah, very important.
I have a question about.
I'm sorry, the lady down here.
First, Bill.
Oh, you know each other, fine. No.
Having experience. So the family members forward in the police department, you dealt with mental issues. And most of us not being doctors and whatever, we have to decide, is this person a danger to himself or others or whatever? And to some degree, while we're detaining them, they're getting more and more agitated. So what starts out as a simple call to 911, you need help, whatever. It can escalate just because you're detaining that person too long. So by calling that 988 number, I would imagine that would shorten the process a bit.
It's
And
100.
improve.
So just to make it clear, right? 988, it's you can have a conversation over the phone with someone, but nobody's gonna respond. Let me put the, what the heck, that's our number. That's the number you guys need to, to have a clinician go into the home and do or whatever the person is to do an assessment is 1-800-435-7968. If you guys want to take a picture, I don't have flyers here. But that's the number to have someone in person showing up. 988 is to have someone over the phone trying to de-escalate. Yeah. That's correct, yes. And we respond within 60 minutes. So some people call, hey, can you come tomorrow? We don't schedule crisis calls because a lot of things can happen, right? Mm-hmm. Right.
988 is that national number, 24/7, someone can be talking to someone, to anyone, to a clinic, a counselor that can, provide resources, de-escalate the person, but it's national. Our local number is this one for mobile response team, it's non-law enforcement response. If you have an emergency, meaning safety of others,
And hopefully the 911 operators are trained in that, is it somebody who's gonna become violent or is it somebody who needs mental health? It has to be made clear when you make that 911 call. Once it's this and escalate while you're waiting.
It even happened like Leslie is one of our dispatchers for MRT. And when you get a call, like the person is one person, when the clinician gets there, different human being. After the call, when the peers are following up, they don't even know who you are. So it changes so much, right? It's so interesting. We go over the calls all the time just to see the quality of the call and so many things, right? And also for educational purpose. And it's amazing. I think everyone should go over those calls, the clinicians, the peers, the BHTs, my boss, everyone. It is a good experience. Sure. The peer specialist. The peer specialist, the difference with a clinician, well, they don't have a degree, meaning they have a lived experience, right? Meaning they are in recovery or they have mental health diagnosis and they are in treatment. So they are in a place where they can serve other people, if that makes sense. So they, and again, like Maria was saying, most of the programs, right, in Dade County have peers, which they are very good at connecting with the clients, at least for crisis, right? So because they've been there, they know the experience. So as far as MRT, what they do is if they are present during the assessment, they can intervene, they can share. The clinician is leading the assessment, but they are more than welcome to jump in as well as a BHT. But their main role when it comes to the program, the MRT, is to follow up after with the family, with the client, with the receiving facility. If they have to go to a meeting to meet them, an NA meeting, okay, I'll meet you there at 7. You don't have car, I'll take you to, you don't have a computer, I'll take my iPad to do a telehealth appointment, those type of things, get their appointment, make sure that they went to the appointment that they had. So again, it's kind of like to prevent that this person falls back in crisis. It's not always successful, but at least I think they do an amazing job. Hmm. Right. Hmm. Thank you. They-
And that's a wrap. Thank you guys so much for coming. I just want to emphasize that we are a fairly new task force. The town of Miami Lakes we just started this in 2020. It took us a while to get up. It's kind of the inception of our little program here and raising awareness for mental health. And as much as I wanted to have all the council here and the mayor, we have a new mayor now. I hope that this is a little seed that will eventually grow into something much larger. And I really appreciate your time and being here, honestly. 1,000, you have no idea. I'm gonna get emotional here, just because, go ahead. Oh, no, it's okay. Mhm, I appreciate that.
Because I kind of, work in this space a little bit, helping people, and I did not know that these specific, I had heard of Project Mind, I heard CIT, but I didn't know
Yeah.
that these resources existed.
And so many providers don't know that. Yeah, so many people don't know it. Go ahead, Frank.
It's a debate there. It's funny because, when my son committed suicide 5 years ago, and that's soon after 988 came into existence, I wanted to point out, somebody mentioned how most people don't know anything about 988. They didn't know then. I have a radio station, we promoted it. We have a platform, my take on it. And yet 5 years later, most people don't. 98 for any of these other, that's a big problem. And the point you make is about a problem that you see escalating. My case was no escalation. My son was as good as they come. And decided that he wanted to turn it off. As a girl, without any pre-indication. I would be called. I would be called.
I thank you guys. I'm gonna cry because it's just like, it's emotional, right? To hear that.
Not us that are the ones that are advocating it, living it, and living through it, right? I know Lindsay does everything she can to put things together. I guess we just have to keep fighting a good fight because, the suicide numbers are not decreasing. Everybody thought with COVID and, all that, it had to stop. And, most people just don't like to listen, don't like to hear about things like that. But it's happening more now than ever, and we need all these resources that we have now, more than ever. But we just also need to get out there and, get more people involved, get more people talking about it.
Don't talk about it. It's something you whisper amongst yourselves. And bringing this out in open is awesome. Thank you again.
Go ahead, Will.
Thank you, Lindsay, let's give it up.
Lindsay's, as everyone knows, is the chair of the mental health task force. I'm just one of the mental health task force members. I'm also the chair of the Veterans Committee with my chair of the Veterans Committee. We have the Fall Fest.
Yeah.
And it was really, we had our first one last year, mental health task force, and it was very well attended. We make it fun for the kids, make it fun for the kids, a lot of folks don't know about your program and they didn't know it. So on behalf of Lindsay, I'm giving you an invitation to set up at no cost. At no cost.
At no cost.
Everybody else. So that way you get your information out. It's a lot of fun. We have a pumpkin pad.
We give away free pumpkins.
We have face painting. I did face painting as long as it was kind of cool. And the kids have a good time. They your tag and stuff like
Yeah.
that. So, we'll get you more information because the way you get the outreach out is to make it fun. And then that stigmatizes it.
Mhm.
Those will provide a way for you to get that.
Thank you guys so much. Appreciate that. All right. Thank you so much. Enjoy your Thursday. Enjoy your weekend. Please take sandwiches.